And on to your top headlines. Today is the final day for vaccinations at Gila River Arena. So it is the last state-run vaccination site that is still in operation.
So joining us live this morning is the woman who fronted this whole effort, Dr. Cara Christ, the head of the Arizona Department of Health Services. Dr. Christ, look at that big smile on your face. So am I assuming that you're happy that these things are shutting down? Have you reached some goals? Take us through the decision to shut this down.
So we've been operating state-operated vaccination sites since January 11th. We today are shutting down our last site. We wanted to make sure that we got through our 12 to 15-year-olds, and we're seeing what any variants we're doing. We've seen decreased traffic, so we determined that it was time to shift our strategy into the community more now.
Dr. Christ, the Biden administration has set that goal for 70%. And of course, we are far shy of that number here in Arizona. Do you guys plan on trying to continue that push, and will we reach it?
We are still continuing that push. We want every Arizonan to get vaccinated. We will be moving from these mass vaccination sites more into the community, where the community members are, knowledgeable about the location. They know the leaders that are running those vaccination sites, and they have the opportunity to ask one-on-one questions from those professionals.
So you're talking about doctors' offices, pharmacies, things like that. So we're not going to see these mass vaccination sites anymore.
If we need them in the future, say that there was a variant that we needed to get more people vaccinated, we could stand these up in just a couple of days. But what you're going to see now is doctors' offices, pharmacies, and then pop-up events such as at community centers, at schools, at community colleges, so that people don't have to travel very far to go get vaccinated.
Well, the numbers between the people that have gotten one dose of the vaccine versus both doses of the vaccine, it seems like there's a little bit of room there for people to still be getting that second dose. What are you encouraging right now?
We would highly encourage that everybody be fully vaccinated, whether that's one dose with the Johnson & Johnson or two doses with Moderna or Pfizer. We know that the Moderna and the Pfizer are effective against the Delta variant, which we have seen in Arizona. And in order to be fully protected and to get the most protection, you want to make sure you've got both doses of Moderna and Pfizer.
So here we are at about 49% people fully vaccinated in our state, Dr. Christ. Where does that leave us protection-wise? I know, we were saying that herd immunity is 70%. So are we not protected as a state right now if, say, we get another 5%? I mean, it's barely trickling in these days. It seems like 0.1% every couple of days we're going up. So are we protected or no?
So we are protected. Even having about 50% of the community provides us protection. Every Arizonan that gets vaccinated from here on out will continue to add to that protection. The vaccine is safe and it's effective. So not only does it protect you if you get vaccinated, but it protects the people around you who you might stop the spread to those people.
Dr. Christ, what are your concerns moving forward in terms of, as we get into the fall with this Delta variant, are you preparing for maybe an uptick or a considerable uptick in cases?
So we've been watching the variants. We've been watching, we have B.1.1.7 here, which was the UK variant. We do have cases of the Delta variant here. We're always watching because we know viruses mutate and that can cause an increase. We didn't see the increase with the B.1.1.7 variant that we were expecting, but we continue to monitor. We're ready to ramp up for vaccinations. Our hospitals have capacity for additional COVID patients if they need it. So we'll continue to monitor and see what the variants look like as time progresses.
Looking back on this whole experience last 14, 15 months, we have this massive crisis. We had a massive response where it seems like our whole medical community was concentrating on something. We had political will. We had a ton of money thrown at it. So what have we learned going forward? How is society better now, and how are we better prepared in the future for whether it's a virus or some other sort of a health issue after this experience?
So I think we had some really great lessons learned and put some things into place that will be to our advantage in the future. We now have a stockpile of personal protection equipment so that, if our hospitals run out or there's a supply chain shortage, we have a supply here in Arizona that we can ship out. Our hospitals also came together and did something very unique with the Arizona Surge Line. It was one of the only ones in the country that was able to make sure that not one hospital was overwhelmed with COVID patients, but that all Arizonans got the treatment they needed at the right time and at the right place. That technology and system is still in place and will be able to be stood up if it's needed again in the future.
Dr. Christ, the work that you and your team have done is really pretty incredible. So thank you so much for your time and information this morning with the Arizona Department of Health.
Enjoy talking with you without your mask on, too. Look at that.
Look at that.
That's the whole thing. We can see you smiling there. So thanks again for all your hard work. And we'll talk to you again soon, I'm sure.
Thank you.
Thank you.